Hi, my name is Carl Aragante. I'm a family therapist and addiction specialist.
Heroin overdose.
What is heroin?
Heroin is an illegal, highly addictive drug. It is both the most abused and most rapidly acting of the opiates. Heroin is processed from morphine, a naturally occurring substance extracted from the poppy seed of certain varieties of poppy plants.
What are the effects of heroin?
Heroin is usually injected, sniffed, snorted, or smoked. Typically, a heroin abuser may inject up to 4 times a day. Intravenous injections provide the greatest intensity and most rapid onset of euphoria, typically from 7 to 8 seconds, while intramuscular injections produce a relatively slow onset of euphoria from 5 to 8 minutes. When heroin is sniffed or smoked, peak effects are usually felt within 10 to 15 minutes. Although smoking and sniffing heroin do not produce a rush as quickly or as intensely as intravenous injection.
What is heroin addiction and abuse?
It is often characterized as a relapsing brain disease that causes compulsive drug seeking and use despite harmful consequences to the individual that is addicted and to those around them. Heroin addiction is a brain disease because the abuse of drugs leads to changes in the structure and function of the brain.
What is heroin withdrawal?
Heroin withdrawal is a physical response when an individual discontinues heroin after heavy use. The initial come-down of heroin withdrawal can vary in time and intensity, although typically withdrawal symptoms begin 6 to 12 hours after the last dose, peaking within 1 to 3 days and gradually subduing over 5 to 7 days. However, some users experience weeks or even months of withdrawal symptoms, and this is known as post-acute withdrawal syndrome, PAWS. What are the overdose symptoms of heroin? The 5 main points. Airway and lungs, which include no breathing, shallow breathing, slow and difficult breathing. Eyes, ears, nose, and throat, which include dry mouth, extremely small pupils, and tongue discoloration. Heart and blood, which include low blood pressure, a weak pulse, pale skin, and bluish-colored nails and lips. Stomach and intestines, which include constipation, spasms of the stomach and intestinal tract. The nervous system, which include coma, delirium, disorientation, drowsiness, and muscle spasticity.